We're really excited to be introducing the Back in Action training program, Phase 1. In this program, we're going to teach core stability. You will also learn how to properly hip hinge, squat, and press.
This is going to help you learn how to get out of pain, stabilize your spine, your hips, knees, shoulder joints, so you can keep functioning, keep moving, and doing the things you enjoy.
Sign up today to get your invitation to this Phase 1 program.
Welcome to the Back in Action podcast, where you're going to hear from me, a spine physician, Dr. John Lavelle, and two coaches, Dusty Holden and Josh Bunch. We're going to help you rethink pain, rebuild strength, and regain function so you can get back to enjoying the things you love in life without limits.
Welcome to Back in Action, a podcast where we discuss how to be prepared for the unknown. With me today, Coach Dusty Holden and Dr. John Lavelle, and we're talking about fitness in your 40s. Dusty, it's a big topic. It's a big topic. We got a lot of notes. Why do people recommit to fitness in their 40s?
Well, I think your 40s, that's typically when you're like in the trenches, I feel like, in life. You know, you've probably, you're settled into a career, you've probably got a family. So there's a lot of like moving parts to your daily life. Yeah. And chances are, I would say that you've probably gotten out of, if you were somebody who had a routine maybe in your 20s and you were fit, or at least, committed to going to the gym, yeah, that there's a very high chance that maybe in your 30s you kind of fell out of that routine. Yeah. And so then you get into your 40s, and that's where, like, I just feel like physiologically things are different. Like you wake up, you kind of feel, you're starting to feel your age a little bit more. Yeah. Doesn't mean that it's definitely not old, but I don't know. There's something about, I feel like when I turn 40, like it just hits a little bit different. So I think 40's like, it's kind of like you find a lot of people rediscovering, maybe, I don't know if I would go that far, but, definitely rediscovering their health, because they've just kind of been, plowing away, trying to just figure out life. And it's like, all right, you've kind of come to
it's when things
a fork in the road.
Things start to break down. So, yeah. And they're like, crap, I don't want to be like this forever. And what am I going to do to be?
What specifically starts to break down? Like, why does it feel so different when you start to get past?
Well, it's when your body starts aging and you start feeling it. Okay. I mean, if we talk about muscles in your 30s, but definitely in your 40s, you start getting sarcopenia, which is loss of muscle mass. And we've talked in prior podcasts that you can lose up to 1 to 2% of your muscle mass per year. So if we just focus on skeletal muscle, which is what I love, because that controls so much of our body. So if you lose that skeletal muscle mass, well then you got to start getting cardiac issues, because your cardiac is a muscle. It's the cardiac muscle, not skeletal muscle. But if you lose the skeletal muscle, then it's not contracting. You're not pumping the blood flow, so you can get higher blood pressure, which can affect the heart. So you're getting cardiac issues. You can start getting pulmonary issues if you're not working out, strengthening the skeletal muscle. You're not getting as good expansion and with the lung function, so you're not getting as good of oxygenation. With loss of skeletal muscle mass, you're getting insulin resistance. So if you have more muscle cells and more muscle, that's what soaks up that glucose when you eat a meal. So if when you eat, you're just vacuuming up that glucose because your muscles are strong and healthy, and you keep growing those muscles, you have more receptors, so more glucose taken in, so less glucose in the bloodstream. So it's not taken up by the fat cells and you get as much insulin spike. That's where it's huge with decreasing insulin resistance. And then you're getting better bone health. Every time you contract those muscles, it's pulling on the bone. You're preventing osteopenia, because when you pull on the bone releases osteoblast cells that start to build new bone. So you can go on and on with the benefits of skeletal muscle. I mean, it is, I would say, the most important organ in our body because it controls so much. And so when we get in our 40s, these things start creeping in. I didn't even talk about arthritis in our joints, because if you lose that muscle, skeletal muscle, you have less protection around the joints. So the joint starts to get some of that wear and tear, which we've talked about a lot, and that can start to become symptomatic. So it's just so crucial, one, to never get to the 40s and not still be working out. But if you're there, to start strength training, because it's also never too late. I mean, within 6 weeks of starting strength training exercise 2 to 3 days a week, you're going to decrease insulin resistance. You're going to improve your cardiac function. I mean, it's profound.
Dusty, is that where you start at? So let's say that I've recommitted in my 40s, it sounds a lot like strength training is where I'd put the bulk of my work. Is that, if I was getting started, is that where you recommend?
Yeah, I would say, like, if you're looking for the highest, return at that age, I think 40s is, like I said, it's just a fork in the road. It's where you start to feel it. You're feeling a lot of the changes. So, and sometimes it's pain. That maybe that's what got people got their attention. But they come to the realization that, hey, what I'm doing is not working. I've got to do something different. Because again, like, you're not old, but you're feeling. You're starting to feel old.
Yeah. How dangerous is it to start when I'm 40 versus if I was just doing it throughout? Is there a more specific, if I jump right in, danger than there would be if I was younger?
I mean, how dangerous is it to start investing in an investment account in your 40s versus your 20s? Same thing. You're investing in yourself. So yes, it would be better to start in your 20s, but is it dangerous to start in the 40s? No. You're just going to...
It's less dangerous than in your 50s.
You're going to start banking that health so you live longer and healthier.
Okay, so then is there a benefit that a 40-year-old may have over a 20-year-old besides maybe the way that they view some of the work?
Well, I would say just wisdom.
Yeah.
It's like you're not, at that point, you're not trying to go in there and ego lift.
A little less
and
proof.
Yeah, it's like you're really, I think you're more health focused than you would be necessarily. You're wanting results, but you're not just results, driven. You actually see the bigger picture.
Well, the why at that point.
Yeah.
Why are you going in there
and chances are that why is like, it's not it could be, it obviously is going to be somewhat physically motivated, but you're doing it for like your family. You're doing it so you can continue doing the things that you want to do. So there's a lot of, I think, other driving and contributing factors at 40 that you probably didn't have, when you were 20.
Yeah.
And so I think it's even more of the reason to do it. And then I also think socially, as you age, it kind of gets like a little bit harder to even maybe meet people or be around. Yeah. So that gives you just another kind of like socialization aspect. If it's, let's say, group classes, people kind of like really connect to those because it's like easy. Hey, now you're getting, the gym and you got built-in friends. So,
Well, it's true. I mean, I don't know, at your gym at Armor, how many guys in their 40s and 50s I've met and now see on the street and say hi or catch up with. It wasn't a group class. It's just we're there at the same time, doing the same thing, similar age range, and it's just natural to start talking to them. It's just the social aspect, I think, is profound.
What about the athletes who stopped because they were either told that they were hurt, that something was wrong, and then now they've went 10 plus years and they feel far worse? So, my back was whatever, my knees were whatever somebody said, or they thought I need to not do this anymore, then they don't. What would you say to somebody like that's wanting to get back into it?
It's the most important thing they can do.
Even if
we created this podcast for that.
That's right.
Because that's so commonly the message that patients hear from their clinicians, to retract, stop doing this type of lift, stop doing this exercise, you get hurt at worse. Well, in fact, in that scenario, people have gone 10 years where they've retracted and not been exercising, and they're worse. It's just the wrong message. So absolutely, it's supporting them, but not just telling them to go do this, explaining why it's important for them to strengthen. So looking at an imaging, if we have, whether it's MRI, CT, X-ray, and how strengthening those muscles is going to protect those joints or protect that, nerve pain down the leg, what they can do in the gym. And what I really like is saying, what you're going to do in the gym is functional movement. So every day you're bending and picking things up off the ground. You're squatting to get out of a chair. We have to mimic those movements in a controlled setting in the gym, strengthen the muscles around there, and that's going to allow you to keep doing that stuff better and more long term.
Dusty, is this where things like a back casting come in? Like, I want to know what I want to be able to do when I'm 70, I want to be able to pick up a toddler when I'm 70. So that means when I'm 40, I need to be able to do X. Do you take stuff like that into account? Do you recommend that athletes look ahead and then say, today I need to be able to do X?
Well, I think you start, again, I think that's one of the benefits of finding it in your 40s is because you do start to consider, a little bit more long term. It's like when you're 20, you think you're going to live forever,
That's true.
At 40, it's just the, I don't know, you're just more seasoned, You do start to take into consideration, like what does it look like, in 10, 15, 20 years? And these are things that I do desire to do, It's like one day it's going to be grandkids, like even where I'm at, I've got teenage boys. So, like these dudes are super active and they're starting to get big. So it's like physically, in order to even be able to play flag football or whatever else with them, it's like you got to be able to have some degree of physical health, and that's something that even long term, I don't want to lose those things. I want it to be there, with my grandkids. Yeah. So you do start to shift your thinking a little bit more from, I think, just the immediate, short term, the season that you're in, to like, all right, like I want to be able still to do these things, in 20 years. So.
Now, you've been training 40-year-old, 50-year-old athletes for a really long time. What's a common blind spot that somebody that could be starting at 40 in terms of maybe a mobility? Like something that you see very often that they may need to pay special attention to if they're just getting started?
Yeah, I would say mobility is a big one, but especially if you've been inactive for...
Do you see one thing more than another, either specifically for guys or specifically for females?
Well, most males, the shoulders are just wrecked.
That's true.
But shoulders, hips... I would say the shoulder one is probably the most common. The other thing too is in your 40s is like you could just wake up one day and your back hurts. It for no reason. There doesn't have to be a specific cause as much as like you slept wrong and today your back's achy.
Or you're speaking more to somebody who is not currently training.
I know. I'm speaking in general. Okay. Like it's very common for some of my clients in their 40s and 50s. Us be training, everything's going great, and then they walk in one day and it's like, man, my back is like it's on fire. And so just because you train doesn't mean that you're immune to these things either. But I think it's also it's just another like motivating factor to hey. We keep moving. We know what we do works. So there's, as time goes on, there's even more, I think, of a buy-in to it because they've already seen, some results to it. They're less apprehensive, to keep moving and not shut things down when something does flare up. And I think that's really important. The other thing is I think 40s and 50s is there's no rush. Like we're not chasing PRs, we're not chasing anything. I mean, sometimes maybe they've got a goal of an event or something that they want to do, but you've got time. Like we can slow this process down, really put the focus and attention into what we're doing and why we're doing it, rather than it be some like, really, really regimented, time-consuming, plan that we're chasing, where we've got like a certain amount of time. We're against the clock. So,
and I think the important thing with that is you're not chasing some kind of clock, and so the key is the commitment and being consistent with the exercise. That's, for me, what I see is the most important thing, is that people keep doing it and not do it for a month or two, feel better, and then stop and give it a 2-month break. It's that consistency that I think, especially in this age range, they start doing and maintain. That's going to make the biggest change.
And we've spoken a lot in the podcast about how the goal isn't necessarily to get out of pain, but doesn't also training change your perception of the discomfort? So if you're intentionally putting yourself in we'll call training uncomfortable, and then you're just living life, which tends to add discomfort to things, that noise gets turned down.
Yes, that nervous system desensitization. So absolutely, if you keep putting in a stimulus to that nervous system through exercise, you're going to lower your threshold for that pain response. So yes, it will help you get out of some pain for sure by whatever the ailment may be, strengthening around it, improving mobility, stabilizing that area, but it's also going to set you up long term. So if other things happen or you have to have an injury, your nervous system is going to quiet down much quicker.
Yeah.
If you've been training that nervous system. So if you're more sedentary, your nervous system gets more wound up, and then you put a stimulus in, it's going to freak out. But if it's used to having a stimulus, now this is very generalized, we could go deep dive into physiologically why that happens with the nervous system, but basically the more stimulus you're putting in, your nervous system is used to it. So it has
this is habituating the system.
Exactly.
Yeah, so you're actually trying to pepper it with these little bouts of active, not necessarily passive activity that are in some way resistance training based, not necessarily more than you've ever done, but a consistent effort, something that's challenging.
And I think the strength training, yes, I started off by talking about how many systems in our body it will affect by maintaining good skeletal muscle mass. But what I didn't mention is the nervous system. So strength training dramatically improves our nervous system response to pain, but if we're in pain, how it recovers. Because many injuries, especially for me in the spine, we don't want to go in and surgically change anything structurally. We want to treat the nervous system around it and how it responds to those changes. And you do that through strength training by putting in that stimulus to the nervous system and getting it to desensitize or adapt and realize this new change in structure is just the new normal.
Yeah.
And teaching the nervous system how to do that through nervous system desensitization, so you're lowering its pain threshold or its spot where it's going to send that pain signal.
Dusty, if
you're raising that threshold.
If you got somebody who's in, let's say, chronic pain that comes to you, where do you start them at? So what would be good if somebody's watching the podcast today that they don't have us here to be able to walk them through that? Where should they start at in terms of how much time generally is good to put in?
In training?
Yeah, so do I start with a Monday, Wednesday, Friday? Is that enough? Do I need to be 6 days? How am I going to work through that? Where does it start?
Well, I would say that you first need to evaluate just the available time. Like you don't. I think a mistake that people make is they go all in, and then it becomes overwhelming. Or it's just too much.
Yep.
So I would first assess what is your available time, and do what you can, but do what you know you can consistently. That's the key. So if one day is all you've got because of your other commitments, then commit to doing it one day. And then as time goes on, I think you're going to see improvement. So that's going to, in most cases, it motivates somebody to want to do it a little bit more, So then it's all right, now they miraculously, they find time and figure out, how to do 2 days.
Yeah.
So that's where, whatever it is, whatever how many days you decide on or what you can commit to, just make sure that it's consistent. That's going to be the key, something that you can do over and over, week after week, month after month. And that's where, as time goes on, when you're able to keep just stacking those training sessions, you really make significant changes. I mean, an example is I've got a client right now that's in his early 50s, had been pretty inactive for the last 10 to 12 years.
Okay.
Me and him started training together in May of this year. And since May, up until, May through probably September, we only trained 2 days a week for 45 minutes to an hour, 2 days a week. For what was that? 4 months.
Yeah.
Okay. In September, he up to that point, he had lost about probably 15 to 20 pounds.
Okay.
In September, we added a third day. And since then, now he's down 35 pounds. He's the lowest in weight that he's been since he was in his 20s. Wow. He's been 2 to 3 days a week.
Yeah.
Not saying that the third day is absolutely necessary, but he was able to work that into his schedule. And I mean, it's obviously just kind of kept propelling him to where he wants to go. But it's the consistency, even of the 2 days, that got him really headed in a direction that he, we didn't even know that he could even achieve, And so what that did is it created more buy-in, to where it's all right, I'm feeling good, I'm getting results. and I want to add in, one more day, and that's 3 days a week of, resistance training. And then he does another day or two, depending on his schedule of, just he'll walk. Maybe 30 minutes, 45 minutes of just walking in his neighborhood.
Doctor, would you say that 2 days is enough for the joint health that we were talking about, the straight up muscle hypertrophy that we were talking about? Is that good?
It's good. I think it's the bare minimum.
Okay.
So kind of to reiterate what Dusty said, if you can only commit to 1 day a week, do 1 day a week.
Okay.
I think most of us can find a little more time than that. I think 2 is absolute minimum. I think a sweet spot is definitely 3.
Okay.
I think that's probably why your patients saw change when they added that 3rd day. You're just increasing that consistency on your metabolism, and you're getting a better metabolic rate, and you're seeing more dramatic, quicker improvement.
Yeah.
We also made nutritional changes, so I want to make sure that is like pointed out, that we didn't just weren't just training and that's the only thing that we were focused on.
What's the biggest levers that you pull for nutrition in your 40s?
Well, one of the things is just assessing like what they're eating. That's the very first place you want to.
Do you have
start.
Athletes? Write it down. Show you a snapshot.
Oh, that's the only way. You gotta. So you gotta have a food log.
Be accountable for it.
Yep.
Okay.
You gotta tell me exactly what the meals look like.
What's common? What do you see most coming back from athletes? I eat all of my calories 10 minutes before I go to bed, or
it's not necessarily timing. It's that they're just always eating. They're snacking, and it's not even necessarily big meals.
It's just constant.
Yep.
Would you say then that the majority of athletes that are watching this are getting started in their 40s, that the first lever of nutrition they should pull is have a defined meal time? Is it, hey man, you're going to eat at this time, this time, this time? Cool, just don't eat in between that?
Yeah, I think structure is definitely going to help. And I think if anything, if nothing else, you're creating a routine. And routine a lot of times that's how you can tweak habits and provoke change. So you've got to have some kind of parameters to what you're doing. So scheduled meal times is a good place to start, and then just log it, write it out, look at it. I promise you probably, once you see it on paper, you'll be able to realize like, oh, I can make some changes here. Yeah. You don't have to be a dietitian or hold a elaborate nutrition certification to be able to identify that. And then that's where you can start to kind of tweak, all right, well then how many calories am I eating, and then what's the macronutrients of that, how does it break down? And
so it's kind of like if I started with a day of fitness, start there, get motivated to do 2, get motivated to do 3. The first thing is write down everything that you're eating, and get motivated to do this.
And I like moving first, man. I think it can be overwhelming for people to try to be doing it all at once. It's like if you're doing nothing and you need to change, make a change, start moving. Get moving, create consistency and a routine around that. And then once you've got that kind of in a pretty good place, if it's 2 days a week, then that's where you can start to peel back the layers on your nutrition. You're going to have to get there if you really, really, truly want to see like the results that are possible. But again, it's like, don't be trying to do it all at once. It's like you use the investing analogy. It's like, well, everybody wants to, we'd all like to have $1 million in our bank account, but you've got to get 100,000 in there first, and then you just build. And as you do that, you create compounding interest takes over, and now things start to happen a little bit quicker. And it's the same thing with training and your health.
When we're talking about nutrition, what sort of and when it equates to pain, when I make a positive nutrition adjustment, what am I looking for pain alleviation out of that? Anything?
Yeah, I mean, and I kind of, when I talk to patients, I do kind of what Dusty said. I try to start with the movement piece first, because they're going to start to see improvement, maybe not dramatically in their pain, but in their mobility day to day and their functioning. And then, maybe a month or 2 down the road, as they're moving better, then I start to bring in the nutrition piece. But the biggest thing for me is decreasing that sugar and inflammation in the body.
Okay.
That's what's going to do the most dramatic improvement in their pain. I mean,
this is where you're talking about being insulin sensitized, so on and so forth. Yep. Gotcha. So versus insulin resistant.
When we have our body is just, when you lose that muscle mass you're going to have increased glucose in the body, then you get increased fat cells, which release a lot more cytokines, whereas muscle cells release myokines, which counteract those cytokines. Cytokines produce inflammation. So if you have more fat cells related to muscle cells, and then you're eating food that's getting stored in those fat cells, you're just really increasing that inflammation in your body. And that's inflammatory markers are what our nerves pick up to send pain. So if you can start to reduce that, you are going to see improvement in your pain.
Dusty, so when we're talking about, let's say that when I'm 20, everything's on the table. Whatever I want to do training-wise, power training, strength training, whatever you want to call it. Does that change when I'm 40?
I don't think it
we can even talk about somebody who's just been training the entire time. So
yeah, I don't think it has to.
No.
And again, I would tell you, like, I mean, if you're somebody that hasn't been training, you can literally like go into the gym and pretty much anything that you do, you're going to start to see, you know, some level of, I think, improvement.
Yeah.
But the big thing is that you need to be excited about what you're doing, you know, and that's where I think, powerlifting, bodybuilding, whatever it is, CrossFit, it's like it needs to be something that you that excites you, like you look forward to doing it. It challenges you, you know, not just that it don't go with what you feel like is going to be the easiest. It's go with something that like you feel like it's going to challenge you and you're interested in it. I think that when people are interested in what they're doing, I think they're just more motivated, you know, to do it. Or they sometimes find it, if you're a competitive person and you're getting challenged, well, then it motivates you to try to like figure out, well, how do I get better at this, you know?
Yeah.
But I do think a lot of times, sorry to interrupt you, when you start getting into your 40s, let's say you're that patient that in the 20s was doing everything, oftentimes that's when you do have to start modifying or changing the intensity of what you're doing. You know, for me personally, doing a lot of CrossFit when I met Dusty in my mid-30s, and then when I got early 40s, I couldn't do 4 or 5 days of CrossFit anymore. So I just transitioned maybe 2 or 3 days of CrossFit and 2 or 3 days of more bodybuilding or strength training. Because I just was getting too much load and volume and intensity on my joints that I would feel things more. And I never stopped, just modifying what I was doing to less intense, you know, metabolic conditioning and more just working on that strength piece.
That's what you're talking about, that wisdom. Like, it sounds like a 20-year-old's not going to be as good at that. And I'm speaking from when I was 20, it would have been really hard to modify or change anything or even admit to anything like that. But it sounds like after you've done it long enough and you want to stay in it longer, you make the right decisions on what do I need to take out, what do I need to adjust. Now, that being said, is 40 a time to widen that training arc? So you said, you know, do what you like to do. That's great.
Yeah.
If the thing that I like to do is 100% powerlifting, is it time when we're 40 that I need to maybe branch out a little bit? Do I need to do a little bit more bodybuilding work? Do I need to do a little bit more cardiovascular specific work? Is that a good time for that, or is it not going to matter?
No, I think it is. I think it's a good time to like assess everything, you know, and I think that's another reason why the 40s are so pivotal, is because it's like, and you may not even, you may still enjoy what you're doing, but physically you're like, you just feel different. You don't, it could be just like John said, you know, like I'm achy, you know, whatever. I chase my kid across the yard and I'm out of breath. So you just start to realize some deficits that you have. And I think it's always a good time to, you know, try something new, do something different and change up. I would also ask yourself the question of, why don't you do the other thing? Like, is it because you're scared of it, or it's hard, or you don't know? And I think all three of those things are good reasons to do it.
Yeah. When you're working with athletes, do you put together like, I know what you like.
Yeah. Oh.
So we do this, but I also know what you don't like. It's still a good idea. We're going to do that. So there's the buy-in thing that I'm happy with, but there's the other thing that you probably should be doing.
Exactly. I want you to come back.
Yeah.
But you don't pay me to like
just
coddle you and babysit you.
Yeah.
So it's like, and I think that's another reason why people do it, is because they know, myself included, left to my own like ideas and what I want to do. Heck yeah, I'm gonna power clean every day and never be on that bike, you know. Right. And so that's why I follow a program.
That's right.
I have a coach because I need to do things that I don't want to do. And I look at that program almost on the weekly and go, God, this sucks. Like, I don't want to do this today, but I do it.
Do your recovery habits need to change? So, you know, when it's 20, we're not even going to talk about all the things you could or didn't do for recovery, but when it's 40, are there things that you're like, I have to do X, otherwise it's just not going to work?
Yes.
Yeah,
100%.
I used to like, I don't know, I spend maybe probably 20 minutes a week doing mobility in my 30s. And now it's almost like I got to spend 20 minutes a day.
So
and if I don't, like, I feel different. Like, I don't feel as good.
But we've worked out together, and you're just strong. So you're just saying that the strength application or your own personal strength doesn't really adjust, but your maintenance time to be that strong has gone up.
Yeah. Oh, yeah.
Okay.
Yeah, I definitely got
And you're talking about mobility, like, are we talking about passive stretching, or what are we talking about?
Everything. Like, even if it's just spending time on the foam roller, you know, or even just breath work, you know, it's like, again, the central nervous system is like so critical, and we are, you know, my everyday is like, it's a lot. There's a lot of activity. And then with all the juggling of the responsibilities and kids and everything, just taking, you know, 5 minutes and just doing a little bit of breath work is a really, really good, critical, I would say, reset point.
And that's for almost the allostatic load of everything that you have to deal with. That calms down all of that.
And it just makes you, it just sets you up to just overall, like, you just feel better. And I think you just have to be, 40 also is like, you have to get more intentional. It's not going to be easy, that you're not going to have time. It's like you make time. And I think that's where, again, it's a really cool time to, for people to either find it, or even, I think being fit in 40, man, is like, it really speaks to somebody's character, you know, because it's not easy. I don't care what your life looks like. In 40 and on, you've got to, like, you're having to put work, you're saying no to probably more than one thing in order to be where you're at. And so,
well, I think that's where the programming comes in. I think it's important to have someone or some platform online where you're getting that programming, because it's a lot, having that accountability makes such a difference when life is getting so busy. Even if it's just simple where I have to check off that I did this day. You know, I think as you're getting older and family and work is just pounding you down in your 40s, you have to have that. I think finding a program, whether it's in person with someone or an AI built program on an app on your phone, I think it's crucial for that accountability, so you stick with it and keep doing it.
Justin, do you agree that those pieces just add up as you get older, like having that accountability or a partner to work out with?
Oh man, partner's like, we train together 2 days a week, and I mean, those are just days I look forward to doing that, because the other days I'm kind of on my own, or maybe with my wife, and those are good too, but it's just having it's conversation and catching up about life. And I think that's again, maybe what people don't even know that they're missing or underestimate the value in it, you know, is just that time that you have to, you know, really just kind of block out all the other things that are going on. And it's a time where you can just be intentional and really just kind of do something that's like making you a better person. And I think that's
maybe actually put the phone away. Have a conversation with a human.
Well, we've been doing it for years now. So, I mean, that's also what's cool, is maintaining that. You know, many times you'll have a buddy, let's meet for lunch once a week. That doesn't happen for very long. But one, we're invested in our fitness and health and realize the benefit, but also we get that social time together. So I think ideally, if you have a group of people or someone to train with, whether it's your wife or friend or something, I think it makes a huge difference.
Now, what are some things that you would recommend to speed up that recovery from a training session? So I'm already somebody that's willing to train, but I feel a little bit more beat up. What are some things that you would do?
I think mobility is huge, as Dusty tested.
Is there a relative time? So Dusty talked about 20 is like non-existent, but when you're 40,
20 minutes is hard, but I think right afterwards, what I've found with patients and myself is doing some static stretching.
Directly after training?
Directly afterwards.
Okay, gotcha.
You know, some people can't do it, so I often will recommend before they go to bed, because things often will stiffen up and get tight, you know, during the night. But if you can do it right after training, I've found that's a practical time to do it.
Yeah.
And it definitely will help.
Does the need for sleep go up?
100%. Well, recovery, that's the big, our body grows. We have an increased growth hormone output even as we get older when we're sleeping and resting. So I think the sweet spot is 7 to 8 hours of sleep at night is so crucial for people, especially as you start getting older and need more recovery.
Yeah.
Also, maybe it's not 5-6 days a week you're working anymore. You might have to, if you're starting to get, joint discomfort, take a day off and don't be ashamed to do that. I think if you can hit 3 days a week and get a couple days off there in between, I think you're going to feel a lot better instead of overloading.
And also go for a walk. Go for a hike.
When I
say
an
ride.
Off day, it doesn't mean you're sitting on the couch all day. Maybe that's the day you're doing more just zone 1 or zone 2 cardio. You're still moving, but you're not really stressing your body.
Dusty, is this a time where certain exercises will play better in 40 than at 20? And I mean specifically if I back squat a lot when I'm 20, is it better to step up when I'm 40? Will I find more of a benefit to taking some of those exercises and adjusting them, or is it still the things that worked the best when I was 20 are the exact same things that worked the best when
No, I think it definitely changes, and I think it's a good time to do some of those different things, and that could be what ultimately helps you keep moving the needle, forward. Is you've just been doing that thing for 10 years, and changing that movement around. Like you gave a good example. I've been back squatting for the last 20 years, and man, it just fires my knees up or whatever. And maybe even as simple as moving to a front squat or a box squat or a step up. There's so many different ways and variations. I think that's what is fun about it, is you're never ever don't if you are that person and you feel like you don't train because of that, that's a lie. There is something that you can do, and if you are stuck and you don't know what that is, then reach out to us. That's what we would love to help people find, creative ways so that they can keep training. I mean, sometimes through social media, we do get people say they've been told not to deadlift, or they've been told not to squat, or they've been told not to press overhead. And that's fine that you've been told that, but that's not 100% accurate. There are
100% wrong. I'll ask them to tie their shoe or get up from a chair. You just did a deadlift and a squat.
That's right.
Yeah, there is some variation of that you can do, and that's why we decided to do the podcast to begin with. Is because we don't want people to feel like you're not doing the thing because of a surgery that you had or an injury, that you had 30 years ago playing high school football or whatever. So it's giving. There's knowledge is power, and knowing that it's really endless. The variations and alternatives are endless. The things that we have created inside the gym for people, it's mind blowing, to start with, but it also unlocks some just life changing opportunities for folks, because they've just been avoiding things, and that's the number one, I think, cause that people get stuck and really go down a dark road is, they've just been avoiding certain things, and we want to knock those walls down and keep people, moving forward.
The one of the last questions I have for you is once you're 40, let's say you've been training since you were pre-high school. How do you deal with the changes that you're probably not squatting as much as you were?
That's hard.
How do you deal with that? So if you're the person that doesn't see the numbers, they can't always go up forever. Yeah. It's not going to happen.
And you think you're going to be that guy that defies
that's right.
the odds.
At some point in time, you're not squatting 800 pounds anymore. So what happens?
I think that's another thing about 40s is where you really start to have to embrace that.
That's right. Is that a good time to not? Obviously, you don't chase the number, the weight on the barbell as much. But is that the time to where you're really trying to, and instead of squatting with a belt, I squat without a belt. I squat without shoes. Instead of doing a step up, I do a crossover. Is this where the variety is what saves you there?
It is. I mean, and that's also what the fun part about it is. It's endless. And have fun with it.
Yeah. And
I think there's a lot of freedom in when you finally lay that down. I fought that for several years of no, this is not going to happen. I'm going to PR that squat clean one more time.
Yep.
And then you just realize that there are numbers that you hit pre-40, and then there is this new life that you embrace post-40, and that is your new,
like that.
your new PR, you know?
Like that.
And so that's what you're working off of those parameters now, and it's just because life isn't the same, you know? And a lot of again, it's the responsibility's not the same. And so when you finally embrace that, it doesn't mean you're giving up or you're, giving in or being defeated or whatever. I mean,
It comes back to that why. What's going to be cooler when you can say when you're 85 or 90 that you had a 600-pound back squat PR at 25, or that you're 85 or 90 and still back squatting in the gym? I mean, that's pretty awesome. That's my goal.
Gentlemen, thank you for your time.
If you enjoy what you're hearing and you want to put this into practice and get moving and functioning better, you can commit to 4 weeks. We can get you back in action, get you moving better. Visit thebackinactionpodcast.com. We have some program that we can invite you into and get you moving and feeling the way you want.
Thank you for watching. Join us for much more where that came from. And when you get a chance, follow us on Instagram and YouTube at Back in Action Podcast.